Hi, thank you for joining us. I'm your host, Nada Youssef, and today we're talking about facial fillers and injectables are growing in popularity around the world. These procedures are minimally invasive and performed in a safe and effective way. They're perfect for those who want to reduce the signs of aging, but who aren't ready for cosmetic surgery. Fillers can plump thin lips, restore facial volume and fullness, soften facial creases and wrinkles, and even improve the appearance of scars. Today, we're here to demonstrate how these treatments can be done in a short office visit with little to no recovery time at all. Here with us today to answer your questions and to demonstrate a lip filler, also known as soft tissue augmentation, we have the Cleveland Clinic dermatologist, Dr. Shilpi Kaderpal. Thank you so much for being here today.
Thank you for having me.
If you want to just introduce yourself to our viewers.
Sure. So, hi, good afternoon. My name is Shilpi Kaderpal. I am a cosmetic dermatologist here at the Cleveland Clinic. We are very lucky to have a wonderful patient, Alexis, with us today who has beautiful lips. We're just going to do some soft, subtle lip enhancement with a filler called Juvederm Volbella, which is one of the newer fillers that came out to the market about a year ago. So you'll see it's very quick, safe, effective, very simple, and her lips are going to look really nice and natural and just enhanced.
So what's the difference between this new product versus the years before?
Yeah, so that's a great question. So this new technology has basically the ability for fillers to last much longer. So, 18 months ago, 2 years ago, the fillers in the lip region would last anywhere from maybe 6 to 12 months.
Okay.
Now we're finding Volbella is lasting 1 to 2 years. So this newer technology, it's soft, it's subtle, it doesn't look stiff. It gives nice enhancement, but it's lasting much longer, which is great.
Okay, great. And with Alexis, was there anything we had to prepare for this procedure beforehand?
So a couple things, we asked Alexis to avoid anything that could thin her blood, so things like ibuprofen, aspirin, any herbal supplements, that just makes it more likely that someone can get a bruise.
Okay.
So we asked the week before to stop that. Alexis has no history of cold sores. If someone did, we put them on some medication that can minimize that risk of something popping up in that area. Other than that, we put some topical anesthetic on to keep her comfortable.
Okay.
That goes on for about 20 minutes. It's an ointment, and then she should be very comfortable throughout the procedure.
Okay, so the numbing agent goes on top and below both lips?
Exactly.
Okay.
So it goes around the lips on the border and on the lip itself, and it just looks like a Vaseline, almost like a lip gloss.
Okay, great. Well, go right ahead.
Let's get started.
Show us what you got.
Great. So we have Alexis here. This is her first time getting any kind of filler. So the filler we're using today, as we mentioned, is called Juvederm Volbella. It is a hyaluronic acid substance. So we have hyaluronic acid in our skin, and basically we're using a natural substance that's a gel that's just going to enhance her natural lips. So first thing, we're going to wipe this ointment off. You can see it's a little bit shiny. And then we're also going to wipe with some alcohol to make sure her skin is nice and clean. Alexis, sorry about the smell. The taste and the smell. So now that we have her lips nice and clean, we're going to go ahead and get started. So the fillers come in a pre-filled syringe. So once we use the syringe on Alexis, this becomes her syringe, and we'll probably use most of the contents. Started here, you can see Alexis has really, really nice lips. We want to make sure that we kind of analyze the proportion of lips. So the upper lip is always a little bit smaller than the lower lip. We look at this kind of 1 to 1.5 ratio. In certain ethnicities, that does change. So we're going to maintain that balance while we augment Alexis's lips. Okay, Alexis, you're just going to feel my touch and a little pinch. So we'll go ahead and just kind of line around the lip first and enhance the border. 1, 2, 3, little pinch. As you can see, Alexis is very comfortable. We'll start to see the improvement and results right away. So put a small amount just in the border of the lip. Alexis, you doing okay?
Mm-hmm.
Great. Okay, and then we'll do a little bit on the lower lip. Bear with me, little pinch, 1, 2, 3. So this is just outlining Alexis's natural lip. We actually haven't put any product in the lip itself, so we're just kind of doing some subtle, nice enhancement. Little pinch, 1, 2, 3. Wonderful. Alexis, just gently open your mouth. We're going to put a little bit now to enhance the shape and size of the upper lip. A little bit right there. Good. Gently close. Now we'll go to the other side and finish on the other half of the lip. Alexis, how's your discomfort?
I really don't feel anything.
Great.
Excellent.
Okay. Just a little drop on this side. Here's 1, 2, and 3. Little pinch. So we can see that product flowing nice, beautifully in. A little bit more on this side, 1, 2, 3. Great, we'll just finish with a drop on the lower lip, 1, 2, 3. Perfect. So That's it for the injection part. Now you can see Alexis has a little bit of swelling. I typically tell people about 20% of what they see is swelling. To minimize the swelling, we will give her some ice. But the full effect, even though she'll see improvement now, it takes about a month for the filler to incorporate with into the skin and to see the full effect. So if there's any areas that look like they're oozing, which they're not, we would hold pressure, but I'm going to give Alexis an ice pack at this point.
Okay. Do people usually get top and bottom lip done at the same time? Do people kind of pick and choose?
You know, I think it varies based on person to person. Some people just want to, you know, a lot of people have a fuller lower lip. They may just want to enhance the upper lip. Okay. But I think it varies just based on what their end result is. I would say almost everyone gets upper lip enhancement. Lower is probably 50-50.
Oh, okay. So that's it. She's done then.
Yeah, she's done.
Oh, that was super fast. After the procedure, or should not be doing?
So I recommend ice. Ice just helps with the swelling, minimizes discomfort. Other than that, there's really no restrictions. She can do whatever she wants. We do recommend no dental work for 2 weeks after, just because although fillers are safe and there's a very low risk of infection, we just don't want her to have any dental work for 2 weeks because the risk of infection can go up. But sure. Ice, and then she can do anything else she feels like.
Okay, great. And then how about like the fillers? Are there different types of fillers that can be used on these kind of things?
Absolutely. So the most common family of fillers are the hyaluronic acid. They vary based on how thick or thin they are. So one we use is very thin, very delicate, but there are thicker ones when we're working on areas like the cheeks or to lift things up. Okay. So most of the most common category is hyaluronic acid, and within that we have about a dozen different fillers that vary based on where we put them and how long they last. But I would say that accounts for a majority of injections because they're safe, they're naturally occurring, and God forbid someone didn't like them, they are fully reversible.
Oh, and they're the same time period for how long it would last? Is that the same? You said 2 years or so?
Anywhere from 6 to 24 months, depending on the filler, how thick it is, and kind of the technology behind it. So the one we use in Alexis is typically 1 to 2 years.
Okay, great. And I'm getting some actually questions from live, so I'm going to go ahead and jump in here. Okay. I have Barb. How often does this need to be done? And is there an age limit for this to work well?
Thinner, and we lose some volume in our lips over time. So, you know, I've done lip augmentation of people in their 80s and 90s. So any age is appropriate. In terms of how often it's done, everyone's a little bit different, but I would say maybe like once a year or every other year is an appropriate time for the lips.
Okay, great. And then I have Liz. She's asking if you numb.
Numbing, we actually use a special compounded numbing agent, so it's not the over-the-counter stuff. It's actually a special compounded numbing agent our pharmacy makes that's a 30% lidocaine. So Alexis had it on for about 15 minutes, and you can see she didn't even flinch. She was very comfortable throughout the procedure, and we do that for pretty much all patients undergoing lip treatments.
Great. Mary wants to know, how much does this cost?
That's a great question. So the cost does vary based on what product we're using. The filler we used on Alexis, the Juvederm Volbella, have more volume, you know, that have done 700 area. Okay. But like I said, typically anywhere between, you know, $400 and $1,000 for the syringe.
Okay, great. And then Amit wants to know, what can you use to clean dirty?
Question, you know, there's different things we can use depending on what it is. You know, there's different cleansers. Some of them have different antibacterial agents depending on what we're treating. Is it more acne? Is it more dirt? But, you know, many cleansing agents that have active ingredients, things like benzoyl peroxide, salicylic acid, those can remove excess dirt and oil and keep the skin looking as fresh and clean as possible.
Great. And then Doug wants.
Absolutely. So we do it in men also because men and women, we all age at, you know, in the same way. Typically it starts a little bit later in men, and men have more lip volume to begin with. When we're doing lips in men, we typically change the shape. So the way in which we do it, we don't want to give them a very full, what we call Cupid's bow, or the central area of the lip. Yeah. So we do kind of change the shape. Men typically have flatter lips, and you know their proportions are a little bit different. So we take that into account with our male patients.
Okay, now I'm just curious, how do you change the shape? Is it just where you're injecting?
It's where we inject, and it's also the natural shape. You know, Alexis had a really nice kind of heart shaped on the upper lip. Sure. Men typically are flatter there, so we don't create something that isn't there.
I see. Okay, great. Now, is it better to use your own fat transfer versus a dermal filler for loss of volume in the face or lips?
So my preference is to use fillers. The reason is if we use fat, it's actually invasive. We do need to do a small amount of fat. Has a lot of water in it. So when you inject the fat, a lot of the increase in volume you see is fluid. So once all that water and fluid is gone, it sometimes isn't even and it's not as precise. With fillers, we know exactly what we're putting from somewhere else.
Great. Now, as people age and lose weight, a lot of kind of like loss of volume under the eyes. Is there something that you do for that?
Absolutely. So the same filler we used in Alexis's lips, the soft, delicate, common injection someone's appearance and is just as easy to do and even probably less uncomfortable than the lip area.
So you're using the same product for the lips as you do for all of the face for fillers?
Yep, for under the eyes, we do areas where we want more lifting, like cheeks, jawline, we use something thicker, but under the eyes is very delicate, thin skin, so under the eyes and lips, we like the same products.
So like is droopy eyelid or?
So with droopy eyelids, there's several things you can do. Obviously, surgery is an option, but for those patients who don't want surgery, brand names in our countries are Botox, Dysport, and Xeomin. We can actually put some, because there's a muscle that pulls it down, so you can get a little bit. The only downside is it lasts about 4 months.
I was just going to ask that.
If you do again, but it's not surgery, it's no downtime.
So, but 4 months is a pretty long time.
Yeah.
So you just inject it around the eyes.
Exactly.
Excellent. Okay, I want to talk a little bit about Botox, because if we talk a little about Botox, what do you do? Like, do people put them around the mouth for relaxing the muscles, or how does that work?
Yeah, so great question. I think a lot of times people get mixed up between what is something like Botox or a neuromodulator and what is filler. So typically we lose volume. So when the cheeks hollow out or we get these parentheses or smile lines or the lips, that's all filler. Fillers are gel that take up space. Things like Botox, Dysport, when people frown and they get those 11 lines, when they raise their brows up and they get those forehead lines, that is when we use things like Botox that we do, and those results typically last around 4 months.
Great. So the fillers are more filling up your face, and Botox is more kind of
muscle
straightening out
exactly
the lips. Okay, great. Now, if someone wants their laugh line solid injections, does this happen that it looks unnatural?
If it's done correctly, it shouldn't. We actually just fill filler like we did in Alexis, and we just fill the line. We're not adding something thick that's going to add volume. We're just simply filling in the line so it looks really natural.
Great. Now, Alexis is such a good sport, but is this pain?
So if it's done without the topical anesthetic, I think it can be uncomfortable, but like I said, we know the lip is a really sensitive area, so taking the proper precautions, putting the anesthetic on, people are really comfortable. And Alexis, how would you rate your pain on a 1 through 10 scale?
I mean, I barely felt it.
Really?
That would be a 1 if that.
Yeah,
wow,
and I would say that's most of our patients' experience is, a 1 out of 10, but like I said, we did have the special topical anesthetic on for about 15 or 20 minutes.
Great, and I'm getting some more live questions. I have Nishat. What are the...
So everyone gets a little bit of redness and swelling that typically lasts a day or two. Sometimes people can get a bruise. A bruise, just like any other bruise, would last for a week. It is extremely rare, I would say less than 1%, to get an infection. And with people that have a history of cold sores, if they're not on the medication beforehand, like an antiviral, they can get an outbreak of cold sores after the injections.
Oh, wow. Like, is that immediate?
Usually within the day or two after injection, they can get it.
And Terry wants to know, how often do they have to be repeated? And I know that kind of probably depends on where you're working.
I think it, depending on what area of the body we're in and, where on the face we're injecting what the product is. For lips, I typically say once a year, once every other year. If we're doing kind of around the mouth, it's once a year. Cheeks, maybe every 2 years. Also what product we're using.
Okay, great. And then Brenda, autoimmune rapid weight loss. The doctor said it won't come back. Would this be considered for me?
Yep, so the fillers aren't going to replace any muscle you lost, but the hollowing you get when the muscle goes away can make people look, kind of sunken and sour, kind of replace some of that volume, and it can look really natural.
Amazing. And then how about people complaining about crepey skin?
Yeah. So when we come to crepey skin, I like to think of the skin as an elastic rubber band. Over lifestyle and aging and genetics, we have a lot of lasers and devices that can address that. And I typically tell people, if they have questions, visit your dermatologist and you can discuss what's right for you.
Great, great. And now, do you ever turn down candidates for this? Is there other candidates that are actually not good for this kind of procedure at all?
So for the injectables like fillers and neuromodulators, injection, an acne spot in the area we wanted to inject, but typically it's, pretty much everyone's a candidate. It's just making sure that we kind of go through the expectations and, I typically say don't do it a week before a big event. Someone has a wedding to go to, a class reunion, in case you get a bruise, you don't want to do it before a week before a big event.
Right. Okay, great. Now, I'm sure most patients are happy. Alexis seems happy. Yeah. If someone is not happy, is this reversible? Is there something you can do to suck it back out?
Absolutely. So it is 100. It's actually an enzyme that dissolves a filler. It doesn't dissolve anyone's natural substance. So if Alexis didn't like it or there were any side effects, it's a very quick.
Is it like dissolves it, or what
dissolves
it? It just dissolves everything.
Yeah.
Okay, great. And what Karen wants to know, what filler is used under the eyes?
So there's several products you can use under the eyes. One of my favorites is the one we used in Alexis's lips called Restylane under the eye. It really depends on how sunken they are, your anatomy. So I don't think one product is right for everyone. It really depends on your age, your genetics, and what the end goal is.
Okay, now do you work with the neck?
Absolutely.
At all?
We do. We do a lot of different things with the neck.
Okay, can we kind of like demonstrate what kind of, sorry,
Sure.
Alexis, we're going to use you again for your beautiful neck.
Yeah. So Alexis's neck looks great. So, you know, I, like Alexis, have something called very, very fine necklace lines. You can see these very, very subtle horizontal bands in the neck. A lot of women come in and over time they get a little bit deeper. These necklace lines are something that we can actually fill, drop a filler in, and it smooths them out. As people get older, they tend to get some crepe to the skin.
Great. And then what about, what is it called? Kybella? Is that
Yep.
something that kind of helps with the fat underneath?
Absolutely. So Kybella is really unique. It came out about 3 years ago, and it's actually a bile salt. So we actually have the enzyme that Kybella is made out of called deoxycholic acid in our body. So when we eat a fatty meal, you eat a burger, French fries, your body really, that comes in an injectable form. And Alexis doesn't have this, but this area right here is called the submental region, or some people call it a double chin. It can be injected with Kybella. It dissolves fat, it tightens the skin, and it can really help contour, and it's just a few small injections, and it's very well tolerated.
Great. And then Sophie is asking, what can be done to remove bags?
And something that people come in very commonly where the bags from, it can either be fluid or fat, and to address it. But like I said, the fat can be removed surgically. If it's fluid, there are other treatments for it that kind of leads to people looking full and puffy under the eye.
So how do you know if it's fat versus liquid?
Yep, so fat stays the same all the time. The fullness under the eye is always there. With fluid, it's actually worse in the morning when people are lying down, and it gets better throughout the day.
Yeah.
So if it changes throughout the day, it tends to be more fluid. If it's the same all the time, it's typically fat.
So it's like when you wake up and you kind of swollen in the face.
Exactly.
That's liquid.
Yeah.
Okay, great.
Absolutely.
Now I can ask you a million questions, but do you kind of want to talk about what things can be done that maybe I'm not even talking about or people are not asking about?
Yeah.
And while we're doing this, I just want to let our viewers know we are talking about cosmetic facial fillers and injectables. If you guys have any questions, please type them in the comment section below and we'll ask them here live.
Sure. So I think a common thing that comes up, a lot of times people come for things like lip augmentation. They also come for neuromodulators, things like Botox, Dysport, Xeomin. So those areas are typically in the upper face. So if we look on Alexis, the most common areas, Alexis, can you frown? So she can't frown because we recently treated her with some neuromodulators. But you know, when people get these 11 lines here, or if you raise your brows up, so this fine movement here, those are areas that are treated with neuromodulators. Or Alexis, can you smile? Smile big. So Alexis doesn't have any crow's feet, but around the eyes here, the three most common areas for neuromodulators are around the eyes, in between the eyes here, and on the forehead. So upper face, eyes and up are always going to be something like a neuromodulator, Botox, Dysport, Xeomin. Lower face is always going to be fillers. So a lot of people get that confused and they say, oh, can't you put some Botox here? But you know, Botox treats the muscle. So anything that's there with or raise up, anytime you have that, that's more of a
More question for you here before I let you go, but where do you go get this done if not at the Cleveland Clinic, which where you should go, but if you don't, where do you go? Because I know.
So I think it's really important to know who you're treating. So I do think that going to someone that's board certified, a dermatologist or a plastic surgeon, and then there's a subset of us who have done, you know, cosmetic fellowships and trained extensively in these procedures. So it's important to know, you know, who you're seeing. You know, a lot of times you may visit with a doctor, but then they delegate the procedure to someone else. I truly feel like it's safest done in the hands of a physician. And then, you know, knowing how many treatments they've done. Is it their first time? Is it their 1,000th one? So knowing their experience. And then also knowing someone that's maybe seen them before. So do your research. You know, I would tell people to avoid, like, you know, Groupons, things like that, because, you know, you want to make sure you're getting the best and safest outcome, because some of these things can have other side effects that, although are rare, if they're done incorrectly, can lead to certain problems.
Yeah, I mean, it's your face, and we've all watched Botched, and it's terrifying to see what
Exactly.
can happen.
Yeah.
Okay, well, thank you so much for being here. Is there anything else you wanted to bring up that I haven't talked about?
Yeah, I think it's for most people to know, like, you know, I think there's a lot of negative stigma out there about facial, and you don't get those big duck sausage lips, you don't have those full cheeks. It just subtly enhances your natural features. You look, you know, refreshed, like the best version of yourself, and you don't look done at all. Most people, you know, Alexis, when she goes back to work today, tomorrow, no one's going to know she had things done. They'll say, oh, something looks good, something looks great, you know, were you on vacation? Alexis is just going to say thanks, but, you know, no one's really going to know what she had done, and I think that's the key to having things done correctly.
Great. Well, thank you so much for being here. Alexis, thank you for being a great support. And for more information on derm fillers and injectables, please visit ccf.org/beautifulyou. And to stay up to date on health news and information from Cleveland Clinic, make sure to follow us on Facebook, Twitter, Instagram, and Snapchat. And we'll see you again next time.
Thanks.
Thank you.